Hi, I'm Dr. Heidi Cook, and this is the Dr. Heidi Cook Show. I am also the owner and the medical director of the spa at West Glen, which is in West Des Moines, Iowa. And part of our being in the medical spa is we get a lot of questions from our clients regarding both aging and things to do for anti-aging. We're all looking for that fountain of youth, that one thing that will impart longevity on us. And to be honest, I doubt there is that one thing. But what there is many little things that we can do that will set ourselves up for not only a longer life, but a better quality of life. So I think we all notice aging in different ways as the years go up. And for myself, a couple of years ago, I have 4 kids that are between 11 and 17. So it's not uncommon that I'm sitting on the floor with them, talking to them, helping them with the project. And what I noticed over the last 3 years, very irritatingly, is that I don't pop up quite as easily as I used to. Once I'm up, my hips are kind of stiff. It takes me a little bit to loosen up. So those are the types of things that we notice as we're aging. And that example actually is a great lead-in to both segments of today's show. One thing that I want to give you more information about is something called hyaluronic acid. We have talked about this on several of the past episodes in regards to certain products and certain treatments to fight aging. But I want to give you a little bit more information on that. In addition to that, we have a special guest on today that we will be talking to. In my conversations with him over the last week or so, I found him to have a lot of great information and to be very intriguing. So when we get back from this break, we will get started with the show. Well, welcome back. Today we have with us a special guest, and this is Matt Johnson. Matt is a graduate of the University of Northern Iowa and graduated with a degree in exercise science from there. From there, he started his career as a certified personal trainer and then noticed that he wanted to do a little bit more that being a personal trainer didn't let him do. So made his way into receiving an education from Body Wisdom Massage Therapy School, and now has just recently opened up his own business called Next Level Muscular Therapy, which is located on Hickman Road in Clive, Iowa, and is also an instructor at Body Wisdom Massage Therapy School. So thank you for joining us today.
Thank you.
So first of all, before we kind of get to the big topic for today, can you explain your shift from personal trainer to what you're doing now?
Yeah, for sure. So one of the biggest things that I saw with personal training is that there are certain soft tissue restrictions that people would have, that would show up maybe in like a movement, like a squat, for instance, that I just didn't think could be relieved from an exercise or, some of the soft tissue remedies that you would have in a gym, like a foam roller, a ball or a stick. And so I found that, or at least I thought if only I could get my hands on to kind of take away some of those restrictions, that would show up maybe or carry over to, for instance, if they lacked knee range of motion, to take care of the restrictions that inhibited the knee from moving through its full range. I could take care of that hands-on, and then that might be able to help them squat better, lunge better, do any pattern really that involved that segment. So,
okay, that's great. I love it when I meet people who kind of start on a path and notice that there's a limitation there and kind of go after trying to remedy or kind of come up with a way to deal with that. So I love that. So for today, summer is here, warm weather, some of us have a little bit more time. We're seeing people, I know I have a lot of friends who are in more activities, playing volleyball at the sands, golfing a lot, and in general, maybe working out more knowing that it's swimsuit season. So along with that seems to be more injuries.
Huge, yeah.
So, okay, so let's start with a definition of what injury is.
Yeah, so injury, very simply, injury happens when the demand being placed on the body is more than what your body is able to handle. So that demand, whether it's the ability for your body to stretch to a certain point or hold a position or generate a certain amount of force to carry out a movement, like any power sport, maybe it is to power through a volleyball swing, what have you, but ultimately that being greater than what your body is able to handle.
Okay. So since we are seeing, or since we do see more injuries during times like this, what can we do about it? Why do we see that increase?
Yeah, so I think the biggest reason why a lot of people end up coming out and hurting themselves, I think they have the right concept. They're just starting from the wrong place. So a lot of people nowadays don't really have jobs that require a lot of activity. So a lot of us are sedentary and we're not active throughout the day, and suddenly nice weather comes out and we all think we can go out and throw 100 pitches or play volleyball all day. And so a lot of times the body's not ready to handle those demands. And so I think that's the biggest reason why people are getting hurt, is because they're going from a place where they've done nothing and now they're trying to accelerate it and ramp up to 100, not having done a lot of the prerequisites in terms of conditioning themselves to being able to handle the loads that are presented and what it is they're trying to do.
So is the best thing that they can do is just take it slower, or prep a little bit longer prior to knowing they're going to be?
Yeah, so taking it slower is one of the big things, and making sure that you have like a gradual progression into what it is you actually want to do. One of the things in strength and conditioning world, there's a principle called the SAID principle, S-A-I-D, that's specific adaptation to impose demands. And so you can utilize that to essentially help progress you into whatever your summertime activities are. So if in your job you've not had demands placed on you, like let's just say it is going to the pits to do some sand volleyball, if in your job you are not utilizing full shoulder range of motion and actually having to produce forces, from your shoulder, to go out and do that out of nowhere will be a tremendous demand for your body. And so if you specifically adapt your shoulder to being able to take on some of those stresses, maybe, if summer's coming, or you got a big outing coming up, you can use that time beforehand to start prepping your body by utilizing your shoulder more. Maybe if you're in the gym, instead of just doing, front to back type presses, explore your motion and rotation. Explore, some of the side to side movements that you might see pop up in an actual game.
Okay.
Yep.
So then, what if someone doesn't do that, gets an injury, and then where do you go with that? And if they came to see you, what types of people do come to see you?
Yeah, so some of the reasons why people would come to see me, a lot of times it is post-rehab or post-surgery, helping them gain range of motion. Another group I see is a lot of people who are just looking for more flexibility, as well as a lot of pre- and post-sporting events. So the person who would come in, essentially we'd utilize a battery of assessments to determine, number one, if I'm even the person they need to see. In some more painful cases, they might need a medical professional, maybe a PT, an orthopedic surgeon to assess and make sure that there's not, maybe some more underlying damage than what was originally thought. But from there, it's just a series of soft tissue modalities that help, clear the restrictions, allow for more range of motion, so that they can now take that new motion and hopefully go out and function with it.
So your particular, so on your website, it talks about orthopedic massage, or is that another name, sports massage? Is that kind of?
Yeah, a lot of people group it in like the sports orthopedic, yeah.
Okay, so with that, we were talking last week that there's not like a sports massage stroke. I mean, there's not a specific that. So there's lots of different things. So is it part massage? Is it also stretching? Is it a group of, a whole bunch of that kind of stuff that you do?
In terms of the orthopedic style, yeah, I think the biggest thing that sets the orthopedic style apart from maybe what you would see with like a Swedish type thing is that you are utilizing certain assessments, to reveal certain dysfunctions that could be classified as orthopedic, injury in nature. But it's basically, allowing me to take somebody and do an assessment to, one, determine if I'm the right person for them, but to two, guide me through whatever it is I'm going to be doing. I don't, me personally, I don't think any massage is the same, because what's good for you is not necessarily going to be good for the next person, and so on and so forth. So we need to be able to isolate the regions that are most problematic for you, make sure they're fully functional, and then if not, that's where we go through and use whatever types of strokes are required. Maybe you need more passive type strokes, maybe you need more active engagement. Some of those muscles might not be woken up, if you will, so we might have to take you through a series of active techniques to help turn them on again and maybe generate a little bit more balance around a segment.
Okay.
Yeah.
And so in addition to that, do you talk to your, I know being a personal trainer, you're, obviously engaged in or aware of, nutrition and all that. Is there other things that you do talk to your clients about?
Yeah, now specific nutritional advice is a little out of my wheelhouse, but it's one of those things that we certainly do talk about. And even other areas just besides nutrition. I mean, some people even have, like financial questions, and all of these things I think serve to make up kind of like your wheel of wellness, if you will. So we definitely have those conversations, and things that, like I said, are maybe out of my wheelhouse, I might refer to other people. Yeah.
And then as far as your position as an instructor at Body Wisdom, so what types of things are you doing there? What types of things are you instructing in?
Yeah, so we're actually starting to blend some of these concepts of movement into the curriculum, just because we know even as practitioners that the person who's just laying static on our table, the issues that they're having actually pop up when they're being dynamic and they're moving. And so I think for me to be able to teach some of the concepts of movement in the context of hands-on manual therapy is helping to one, boost the level of the therapist, but two, I think it brings a whole new dynamic to massage therapy itself, because we're now not just thinking about how are we pushing tissue on a table, but what are we doing that's going to help carry over to the activities or the motions that they'll be doing in real life.
Okay.
Yeah.
So if you are noticing some physical signs of aging in yourself, if you are wanting to get more active, or if you have an injury from perhaps doing too much too soon, this is something to consider. Matt is at Next Level Muscular Therapy, which is on Hickman Road in Clive. And so we'll give you his information, and thank you for joining us today.
Yeah, thank you.
Welcome back. So today I would like to talk about hyaluronic acids and how they affect our aging and how we can use them for anti-aging. So what is a hyaluronic acid, or what I might refer to as an HA? They are glycosaminoglycans. Big word. Basically, it is a long chain of carbohydrates that is naturally produced in your body. So when this substance is in your body, it is hydrophilic, meaning it loves water. So it attracts water, and then it's a gel-like substance. So this gel-like substance is one of the most highly researched substances in the medical field right now. There's thousands of trials going on looking at hyaluronic acid and its benefits in therapeutic treatments. Most of these studies are in the areas of orthopedics, ophthalmology, and dermatology. Obviously, the skin portion of this is what I am most interested in, know the most about, but this took me on a little adventure of looking more into hyaluronic acid. So our body naturally has hyaluronic acid, and it's all the time breaking it down and making new, so constant turnover. A thing to remember here is that as we age, our production of hyaluronic acid does decrease, to the point that when we are between 40 and 50 years old, we have about a 50% reduction of the hyaluronic acid in our body. So it's kind of a big turnover, and we don't keep up with it as we age. So the different places that you can find hyaluronic acid in your body, it's almost in every cell, but it is much more concentrated in your connective tissue. So where is that? So you have higher concentrations of HAs in your articulating cartilage, which is your cartilage in your joints, also in your synovial fluid, which is the fluid in your joints. It's in your eyes, in your gums, and 50% of all of your hyaluronic acid is in your skin. So before we get to the skin portion, let's take a look at the other things. And when we're talking about this, I want you to remember that as you age, you really decrease your hyaluronic acid. So the function of your HAs in your joints, so it's in the articulating cartilage. It's called hyaline cartilage, hyaluronic acid. So those are it covers the long bones. So think of knee joints, hip joints, shoulder joints. It's that articulating cartilage. What its function is it cushions and it reduces wear and tear. And then in addition, the synovial fluid, which is the fluid that is in your joint that causes things to glide smoothly, also has hyaluronic acid. So as you age and you have a decrease of production, you have a decrease of HAs in all of these places, so you have less cushioning, more wear and tear, and less smooth gliding of a joint, which then leads to osteoarthritis. So osteoarthritis, very common, and what we know we can treat it with is anything from anti-inflammatory oral medications all the way up to surgery. What orthopedic surgeons have done and still do on occasion is they actually do injections of hyaluronic acid into the joint space. This puts hyaluronic acid there, providing a little bit more cushioning and a little bit more prevention of wear and tear. It helps with inflammation, it helps with pain a little bit. So that's one way that hyaluronic acid is used against aging. So other places it is a big part of what is inside your eyeball, basically. So it's called the vitreous humor, and most of that is made up of hyaluronic acid. It keeps the shape of the eye, and it's often used in eye surgery, ophthalmology, in surgery. So as you age, hyaluronic acid decreases, the vitreous humor can decrease, changing the shape a little bit, which can lead to some of those issues with aging eyes, dry eyes, and pulling for your reading glasses. So those are other ways that we notice aging due to hyaluronic acid. So then we get to the skin. So like I said, 50% of our body's hyaluronic acid is in the skin. Its function there is because it loves water, it is a great hydrator. Now when we think of the skin, a lot of us think of the collagen. That's what provides the firmness and the tone to our skin. But it is the hyaluronic acid which provides the nourishment and support to that collagen. If you think of collagen as a rubber band, it's got that elasticity. And over time, your skin stretches, gravity takes effect, and if you think of that rubber band stretching, eventually it gets a little saggy, and if there is no hydration, as it ages, it gets dry and brittle and can easily break. Then think if you had that same rubber band in water, and you're doing that same motion, there's not as big a chance of it breaking because it's hydrated and it's nourished. So that's the kind of collagen hyaluronic acid relationship. But as we age, our hyaluronic acid decreases in our skin also. That's when we start noticing dehydrated skin, loss of volume, and then those fine lines and wrinkles that appear. So the different places that we use hyaluronic acid, and these are the things that I've mentioned on some past shows, is the injectable fillers are typically, the ones that we use most often are hyaluronic acid. So Juvederm, Voluma, Restylane, those are all hyaluronic acid. What they do is we put those into places that have either lost volume or those fine lines and wrinkles to kind of lift. They pull in extra water and fill out that area even more. In addition to that, we also have a treatment called the hydrofacial, which is a process of it cleans out the pores, cleans out the debris, and while those pores are open, we infuse all the good stuff, antioxidants and hyaluronic acid. So it gets a plumping of the skin, which gives you relaxation and plumping of those fine lines. Finally, I wanted to talk about the product that is sitting here, which is called HA5. It is by Skin Medica, and what it stands for is hyaluronic acid 5. There's 5 different types of hyaluronic acid here. And this is a product, the thing I love about this product, it is something that every skin type can use, from dry to oily. Oily does not, you can be oily and dehydrated at the same time. So this is a product, especially as you're hitting at least 40, that everybody could benefit from. It has some immediate effects, and I have a picture of before and after. It's of a 63-year-old gentleman who used this hyaluronic, or this HA5, the before, and then 15 minutes later, if you look around his eye at the crow's feet, you can see that even in that 15 minutes after application, the difference that this makes by holding in water and plumping up those areas. This product also has some time-released hyaluronic acid in it, so it will last you all day long. It has a product that will help stimulate your own hyaluronic acid production, and in addition, one that will prevent the breakdown of your own hyaluronic acid. So this is a great product. I typically recommend it for all of my injectable patients who are getting fillers with hyaluronic acid. It's just a nice additive. They work synergistically. But this is a product that helps with all those signs of aging, fine lines, dehydration, it's one of my favorites right now. In addition to these things that we've talked about, there is an oral supplementation of hyaluronic acid that you can take. The typical dose is 100 to 200 milligrams a day, and it takes about 2 to 3 weeks to start seeing effects. And then what you notice is a lot of times if you have that joint pain, that will be improved. You'll notice differences in your skin and differences in your hair. And some people have even talked about being able to get rid of those reading glasses. So for an anti-aging therapy, some HA is something to look at. Thank you for joining us today. So after today's show, I hope that we have been able to describe to you hyaluronic acid and its effect on aging, and that you can see how it might just be a little bit of that piece of the fountain of youth. In addition, our guest today brought us some great information on what we can do to prevent those signs of aging as far as the physical signs of aging, and what we can do if we get going too much and notice some aches and pains due to our activity. So I hope you learned some things about anti-aging today.